A common question I get asked in practice is, what medication should I take, or should I take any anti-inflammatories? Ideally, the answer is none. And I ask people to answer these 3 questions before taking any medications. The first one is, can I function in day-to-day life without them? Number 2 is, are there any less toxic ways or more natural ways to help deal with the pain? For example, ice. Maybe there's a hot swollen joint and some ice would help bring that inflammation down and make it more comfortable. Or heat. Perhaps those muscles in the neck are really stiff and sore, and maybe a wheat pack or a hot pack will help ease that off. Maybe it's a hot bath. Also, rest will do wonders for pain, and a good night's sleep. Sometimes we get headaches from dehydration, so just looking at our water intake can make a big difference to that. Then the third question is this fixing the underlying issue? Now, anti-inflammatories can relieve pain in the short term and are pretty effective with that, but they try to block various parts of the inflammation process. And by doing this, they actually interfere with the body's natural healing process. So, because there can be no healing without inflammation, that's going to create problems. And anti-inflammatories can actually delay ligament and tendon healing. And now a new study from McGill University, which is down below, shows that using them can actually increase your chances of going on to develop chronic pain. So anti-inflammatories are not always helping us heal, and they can cause problems for us later too. The healthy order in approaching pain is first to ask, well, can I use any natural approaches? Second one is to book a visit with us to find out what's causing the pain. Because if you don't know what's causing it, you can't really deal with the underlying issue. Then only after that should we really look to drugs and increasing potencies, starting with more less toxic drugs and then moving up the scale, ending up with steroids and things like that. But those will be up to your pharmacist and your GP to ask for. And then only lastly do we opt for surgery. Sometimes people want to jump those guns and change things. I recommend we stick to those orders because it's a much more healthy and natural way and honoring our body's natural and healing abilities.